My dear student, today topic is anomalies in chromosomes. What is anomalies? Anomalies means defective, defective in chromosome. And there are two types of defectives: defective in autosomes and defective in sex chromosome. First of all, the anomalies in autosomes. The first disorder, that is Edwards syndrome. It is also called as 18 trisomy, and the total number of chromosome 47, and this type of syndrome generally takes place in female as compared to male. Here the fingers of the patient become tight along with palm, and it also shows mortality rate, and death also occur in the patients. This type of syndrome is called Edwards syndrome. The second one, that is Down syndrome. It is also called as 21 trisomy. Here the patient is short height, round face, eyes are widened and open mouth along with protrude tongue. This type of patient have low intelligence, so they are also called as Mongolian idiocy. They can survive up to 56 years. The next one is Patau syndrome. It is also called as 13 trisomy. And here the patient have cleft in the palate. It has high mortality rate. The patient become dead soon after birth. That means the child become dead soon after birth. The next one is cat cry syndrome, or it is also called as cridocat. Here small fragment deleted from the chromosome number 5, and the sound of the baby is similar to the cat cry, so it is also called as cat cry syndrome, and it is very rare. Next one is 21 monosomy. Here the number of chromosome 45, and its character is just opposite to the 21 monosome. Some character, not all character, some character just opposite to the 21 trisomy. 18 monosomy, also number of chromosome 45, and its character also opposite to the Edwards syndrome, but having high lethality. The next one, that is Burkitt's lymphoma. Lymphoma, cancer in lymphocytes. How the cancer of lymphocytes takes place here in this disorder? What happens? Some segment or fragment removed from chromosome number 8, and a attached to the chromosome number 14. That causes the activation of gene MYC. When that gene become activated, that leads to the increase in number of lymphocytes, and that is called Burkitt's lymphoma. The next one, that is myelogenous leukemia. Here, the exchange of fragment takes place between chromosome 9 to 22. That causes the activation of gene AVL and increase in number of leukocytes. This is called myelogenous leukemia. Then retinoblastoma. In retinoblastoma, what happens? There is deletion in chromosome number 13, and that causes the cancer in retina of the eye, that is retinoblastoma. This is all about the anomalies in autosomes. And the disorders occur due to the anomalies in sex chromosomes are Turner syndrome, Klinefelter, superfemale, supermale. The Turner syndrome, here the number of chromosome 45. That means monosomic conditions. And here the female sterile, breast underdeveloped breast, reduced ovary, aggressiveness, etc. And its karyotypes is 44 plus X due to the absence of X chromosome. Next, Klinefelter syndrome. Here, the number of chromosome 47. There is 2n plus 1, that is trisomic conditions. The male sterile, having female characteristics. And this karyotype is 44 plus X, X, Y, extra X chromosome. The next one, that is super female. Here the number of chromosome 47 or 48. In this case, the female, in female, disease appears, different disease appears, or the female fall in different diseases, and its karyotype is either 44 plus reflex or 44 plus XXXX. Superman. The number of chromosome 47. Here the karyotype is 44 plus XYY, extra Y chromosome. That means the person is criminal minded. And that kind of syndrome is also called as Jacob syndrome. This is all about the sex. Now the question is why this is happening. 44 plus X, 44 plus XX, XXY, 44 plus triple X. This occur due to non-disjunctions. non-disjunction. How it is happening? If this one is male, 44 plus XX. This one is female. What happens if the non-disjunction takes place? These two chromosomes, they are not separated. Then what happens? The gamete will this like 22 plus XX. That means these two X are not separated. And here the non-disjunction does not take place. So the gamete will be this like when these two things combined to gametes 44 plus X. When these two things combined, what happens? 44 plus X, Y. That means this one is Turner syndrome and this one is Klinefelter. Now the question arises, how superfemale is developed? Superfemale is developed due to the non-disjunction in meiosis. Meiosis 2 or meiosis 1. Meiosis 2 and meiosis 1. How? Suppose XY, XX. This undergo meiosis 1. Then what happens? This undergo meiosis 1. Then if this undergo meiosis 2 and this also undergo meiosis 2, if this gamete in meiosis 2 become non-disjunctions, then what happens? The gamete will be this like 22 plus XX, because meiosis 2 is a mitotic divisions, the doubling of takes place. This one is double, but this double and go to the one side. Similarly, in this case 22 plus YY, and here there is no disjunctions, normal things. 22 plus X, 22 plus X, 22 plus X, 22 plus X. Okay, when this and this one combined, what happens? 44 plus X double Y, that is supermale. And when these two things combine, what happens? 44 plus triple X, superfemale. In this way, the anomalies in chromosome completed. In the next video, we will study about anomalies in genes. This is all about the chromosomes, and here there is anomalies in gene. That means defect in gene. There is a mistake that the segment not transmitted from 9 to 22, it is from 22 chromosome to 9th chromosomes, and that causes myelogenous leukemia. Okay, thank you. Please like, subscribe and bell the icon. Thank you.